problem in society we have at the moment is everyone is afraid of making a mistake.
What may happen if we don't do anything?
The pandemic has changed life as we know it. But what comes next? Will our fast-paced lives pick up again? Will we continue to innovate, regardless of the cost? Live lives profit-driven and globally connected? Or has this pandemic sparked irrevocable change?
Hello and welcome to the show. This week, we're thinking about life after the pandemic. We're asking experts in areas like urban planning, climate change, and even nutrition to tell us what they've learned so far and what those lessons mean for the future. Today, we look at crisis management and begin with a report from Taiwan.
Located near the airport, Taoyuan Hospital was one of Taiwan's gatekeepers against the virus. Authorities had sent a fifth of confirmed cases here for treatment since the start of 2020. But in January this year, an infected doctor triggered a fresh outbreak. Several of his co-workers were later tested positive. Taiwan faced its biggest coronavirus crisis since the start of the pandemic.
Hospital-acquired infection is very serious and hard to control. Patients in the hospital need healthcare workers to take care of them. They're next to each other. It's impossible to just quarantine hospital workers and leave patients alone.
Wang works at the Central Epidemic Command Center. He soon decided to set himself up in the hospital to directly oversee communications from the command center.
We had to contain the virus. Time was key.
In a large hospital of more than 2,600 employees and around 700 inpatients, one wrong decision could lead to the tragedy similar to the 2003 SARS outbreak. Then the government locked down a hospital where even healthy people were not allowed to leave, leading to 154 infections and 31 deaths.
It was okay when there were only 1 or 2 cases in the hospital. But when there were more and more people confirmed positive, we were definitely nervous. We were afraid of getting phone calls in the middle of the night, hearing about yet another new case.
This time, the command center reacted quickly, tracking all possible contacts and home quarantining over 4,300 people. They also transferred negative tested patients to other hospitals to decrease the workload on staff. After 14 days with no new confirmed cases, all hospital employees had to do mass testing to convince the public that the hospital is safe. In 44 days, the outbreak was contained with only 21 cases and just 1 death.
Transparency and honesty is very important, and you have to give the people the reason why you want to have a very stringent contact tracing and very stringent home quarantine, and the evidence. We have to show the evidence that it is very, very useful.
To prevent the future pandemic, Chen said no countries can fight alone.
I would like to re-emphasize the important thing is the prudent surveillance. We have to keep eye on the possible outbreak in all the countries to prevent its spread out.
Now, Taoyuan Hospital is back to relative normality. The SARS experience reminded the government and its people not to let history repeat itself. A lesson not only for Taiwan, but for the world in its approach to tackling this fast-spreading virus.
Martin Rees is co-founder of the Center for the Study of Existential Risk, an interdisciplinary research group focused on studying and developing strategies to risks that could threaten humanity. Martin, it's good to have you on the show. First of all, let's start with the pandemic before we talk about existential risk, rather. I can barely even say the word. We just saw about Taiwan and how its management of the pandemic has been shaped by SARS. But at the same time, other countries have had their own experiences with infectious diseases, and yet they've struggled in their management of the pandemic. Why do we see that it differs so much from country to country?
Well, I think we in the UK had prepared for an influenza pandemic. But of course, we didn't have the experience of SARS. And of course, coronaviruses need different preparations. They need protective equipment for everyone, and it's hard to develop a vaccine, etc. So we in the UK were badly prepared, as I think in some respects were other European countries. And I think the Taiwan had a government that was more trusted perhaps than our UK government was by its people, and that helped.
Do you believe that we're worse long-term planners than we believe we are potentially, or do we just lack imagination, or is it a combination of both?
I think we are worse long-term planners. Obviously, we can't predict when a pandemic would strike, but no one could say it was unlikely, given that we had SARS and MERS in the past. And I think there are some lessons we can learn, obviously. One is that it pays to build in a bit of slack in the system, more resilience. I mean, for instance, I know in Germany you had more empty beds in your intensive care wards than we normally have. We try and keep them full all the time, which means you've got no spare capacity. And also, we shouldn't depend so much on supply chains for manufacturing, because if you have just one long chain and one link breaks, that screws up a lot of manufacturing. So I think we've learned that it's more important to have resilience than maximum efficiency.
Okay, so perhaps we're not the best long-term planners for things like pandemics, even though actually they're quite likely. What about for truly existential threats, what you're focused on? That could be anything, I gather, from a more serious illness to an asteroid, potential asteroid strike. What does that mean for planning for those threats?
Well, of course, you can't. They're just extremes. And I should say that although I'm an astronomer, I'm not kept awake at night by asteroid threats, etc., because they are small threats and no bigger now than they were for the dinosaurs. Very rare. But the threats that we do worry about are those which are caused by humans, either collectively changing the climate and causing mass extinctions, etc., or by misuse of powerful technologies, bio and cyber, etc. So those are the things we worry about, and they will give us a bumpy ride through this century. They could cause a complete extinction, though I think that's frankly very unlikely. We're concerned with these extreme risks, which we need to prepare for. And going back to the COVID-19, it's going to cost the world at least $20 trillion over the next few years. And in that perspective, and given it wasn't that unlikely, we should have spent probably hundreds of billions of dollars in the kind of preparation, making sure that we monitor all the places where the disease can transfer from animals to humans, etc., and to be more prepared and to stock up on protective clothing and all that. We've learnt our lesson that it's worth a bigger investment to be more prepared.
That investment, that preparation, that readiness, that always comes with other costs, not just money, for example, but there are certain social costs that come with that, as we've seen with the pandemic as well, just responding to the crisis. That's been a great cost in terms of social well-being, perhaps, in terms of economic well-being for livelihoods. Have we fully measured the social and economic impacts of the pandemic, and what does that mean for our planning for crises?
Well, we haven't, and I think one possibly benign effect of the COVID crisis is to realize how important workers are, not just direct in the health service, but delivery drivers, carers, and people like that, who in our system are under-supported, poorly paid, and in insecure jobs. And I think one lesson we ought to learn is to minimize or reduce inequalities, which have been actually accentuated by the pandemic. And people like myself, for instance, can go on working from home, etc., but many people can't, and those who are in cramped apartments with no gardens, etc., have had a really tough time. So I think the experience of the pandemic has accentuated the effects of inequalities, which many of us think are far too great anyway, and I hope there will be pressure to reduce them.
Martin Rees is co-founder of the Center for the Study of Existential Risk. I'll get that word right eventually. Martin, thank you so much for joining us.
Thank you very much.
Well, our science correspondent, Derek Williams, is also thinking about the future. Here he is with a question on the future of mRNA technology.
We came up with vaccine for COVID in under a year. What do developments like that mean for the future of healthcare?
COVID-19 vaccines represent an absolutely immense achievement. In the midst of a raging pandemic, governments and pharma companies and scientists came together to produce vaccines at lightning speed to fuel the biggest vaccination drive in history, which is now progressing at an astonishing pace. Additionally, the coronavirus has triggered an absolute avalanche of research that's already having ripple effects on areas far, far beyond healthcare. SARS-CoV-2 has promoted even closer cooperation between science and industry, while at the same time revealing glaring weaknesses in healthcare systems. It's also exposed the many, many ways that it's possible for governments to mess up communications with the public. Despite all that we've gotten wrong, though, I remain positive overall, and I think that history will look back on these years where so many lost so much as the first time that humanity came together on a global scale to fight a problem that threatens us all. COVID-19 has sparked advances in a really wide range of fields, but I want to focus on one advance in particular that experts say will change healthcare in fundamental ways, and that's messenger RNA technology. In cells, mRNA is the molecule that allows information from the archive of the genome to be turned into the physical metabolic reality of proteins. And controlling and tailoring proteins is a tool of incredible power. Scientists have been trying for decades to harness the mRNA information system to fight a huge range of diseases. Then the pandemic hit, and all that hard work ended up turbocharging the development and the launch of the mRNA vaccines now in use, the first ever to be approved. That's released the floodgates, I think, and we can expect more vaccines based on the platform to hit the market in the next couple of years, including highly individualized vaccines that help your immune system, for example, zero in on cancer. Mastering mRNA will allow us to shift treatments for many diseases away from today's approach, which is to mitigate symptoms with medications, and towards addressing the real roots of diseases. And that's huge.
And that's it for today's Peek in the Future. Check back with us tomorrow. Thanks for watching. Stay safe. See you again.